Awards. So I'm gonna, since we're an intimate group this afternoon, I'm gonna invite everyone to introduce themselves for part of this conversation, and would love for people just to share briefly what brings them to this table, and in a very quick sentence about why they are interested in learning more about the Common Health Coalition's challenge focused on community health workers, and this webinar being one that we're going to talk a lot about the Catalyst Awards that'll be a component of the Common Health Challenge. So I'm going to start, and then we'll popcorn it around to folks and just briefly invite you to share your name, your organization, and what brings you to this table. So my name is Sarah Ziegler. I'm with Courage Forward Strategies. We support the Common Health Coalition work. And I am here because I'm really excited to see how we can build stronger partnerships between public health and healthcare, and really elevate the role of community health workers to provide direct services more intensely in communities, and really narrow our inequities in our society. And with that, I'm going to turn it over to Chelsea. And then if you'd popcorn to someone else, please.
Yeah, absolutely. Hi, everyone. I'm Chelsea Cipriano. I'm the managing director of the Common Health Coalition. And so I'm so grateful for you taking time today out of your busy schedules to be here with us and to learn more about this exciting opportunity. I'm excited to be here for a whole lot of reasons, but mostly just because this gives me hope in a time where I think hope is really important in the health space, and hope and building trust. And I'm just really excited for this work to build on the hundreds of years of existing work of community health worker efforts in this country. And it gives me hope to help expand and help all of you do more work and impact. So I will popcorn it to Michael from Nashua.
Hi, all. My name is Michael Matthias. I am a project manager with the National Association of Community Health Workers, and we are participating with Chelsea and Sarah and Aaliyah on this great program we're going to hear more about. So that's why I am here, and I'm really happy to see what you guys can see with what we're doing. And I will popcorn it to Aaliyah.
Hey everyone, my name is Alia Ali, and I am also with Courage Forward Strategies like Sarah, so I will not say more about that, but what I will say is I'm just really excited to this is an inaugural a challenge, and I'm really excited to kind of see where this goes. I think community health workers, like Chelsea said, have historically been a linchpin for many things for across the years. And so I just think that this is such a great opportunity to elevate that, and a great time to do that. So I'm really excited to hear from you all. And I am going to pass it to Kelly Nielsen, I think.
Hello, everyone. Kelly Nielsen. I am with the Omaha Pathways Community Hub. We are an initiative connecting health plans, health providers, and community organizations to better address the social needs of our community members. It is a community-based care coordination program, leveraging the talent of community health workers. I've been involved with CHW programs for over 10 years, and just interested in learning more, and doing what we can to grow the impact and sustainability of this workforce. Let's see. Diane Stefani.
Hi, myself and Jim McGuire, we handle public relations for the Common Health Coalition, and I'm extremely excited about the challenge and next steps. And I will popcorn it over to Jen McGuire.
Ditto what Diane said.
Okay, then popcorn it over to someone else.
I've got Samira.
Hi, everyone. My name is Samira Pocharaju, and I work at the Washington State Department of Health. I'm part of a relatively new office at the Department of Health. It's called the Office of Global and One Health. And part of what our office does is looks at best practices from around the world in global health, including community health workers, and how those models can be applied locally to communities in Washington, specifically underserved communities and immigrant populations. The Department of Health already has a lot of great programs that they've done around community health workers and training and trying to create some sort of uniformity in training of community health workers. So we're really looking to build on that work and augment some of our community health worker programs. And hearing about this challenge is just a really great opportunity for us to expand our work around CHWs. Nice to meet you all.
Thanks for joining us. We appreciate you being here. Why don't we go to Tracy?
Hi, everyone. I apologize. I am eating lunch, so mid-bite. Hi, everyone. My name is Tracy Simmons. I'm the Director of Community Health and Engagement at Rush, which is the Rush University System for Health, primarily based at our medical center site, but I also oversee programs at our Oak Park sister hospital site in Oak Park, Illinois. And we are hoping to systematize our community health worker hub, our work, which I directly oversee across our system, which also includes a hospital system in Aurora, Illinois. So with that, we've recently come across this group and thought it would be a helpful resource for us to look into, to learn more, and then also really kind of what we need to keep top of mind as we look to continue systematizing our work. Thank you all. I will hand it over to Amy if she's not gone yet. And I think you might be on mute.
I'm so sorry, I hit the button. Thank you very much. My name is Amy Freeman. I'm one of the faculty co-directors of the Community Health Worker Research and Resource Center at NYU Grossman School of Medicine, based in the Department of Population Health. And we mostly serve as professional support and development center for staff at who work through both research and direct service at NYU. But we also are involved in some advocacy and some research and some general bringing together best practices and things like that. And yeah, I found out about the coalition not too long ago. I'm interested to hear more about the Catalyst Award and think about, we have some partnerships with our local health department and seeing how we can work together to move some of this forward. I will pass it on to Kushal.
Thanks, Amy. Hi, everyone. My name is Kushal Kadakia. I'm a fellow at the Common Health Coalition and very excited to be here. I'm passionate about this work because I'm excited about partnerships between public health and healthcare, and I think that community healthcare workers are right at the center. And so especially at this time, as we reflect towards the end of the year, I think this is a project that gives me a lot of excitement for the new year. And I will popcorn it to Rebecca.
Thank you. Hi, everyone. I'm Rebecca Giglio. I'm brand new to the Common Health Coalition team as the new deputy director. And this challenge is certainly one of the reasons why I wanted to join the team. So super excited about it. And my window into the benefits of community health workers is certainly from my time in New York City during COVID and working with the health department and the public hospital system. So yeah, super excited. Evilise, I don't think you've gone yet. Is that right?
That's correct. Hi, everyone. Delighted to be here. I'm Ivelisse or Ivelisse, and both pronunciations are correct. And I am the CEO of Radical Health. And what we get to do is we really believe that no one should have to health alone. So we use restorative justice and restorative health practices and circles to hold the space for folks to navigate the healthcare system. And in addition to that, we provide fellowships and training. So really training community health workers and other healthcare practitioners how to incorporate restorative practices in the work that they're doing to really center the needs of the people who need it most. So based out of New York City, we work across the country, but really delighted to be here. A board member sent this along and just feels really aligned. And so it's lovely to be here, but also to be in such good community with a bunch of folks with a similar alignment and understanding the value and the need for what's ahead.
Wonderful. And thank you for joining us. And I think we will go to Lisa.
Greetings, everyone. Lisa Teeler, pronoun she, her. I am the Executive Director of the Bay Area Community Health Advisory Council, and we are focused on eliminating health disparities across diverse communities. San Mateo County is in Northern California, and although it is a very wealthy county, there are several pockets of underserved communities. We're a small community health-based organization, really focused on advocacy, connection to services, and health education. And we do that in a variety of different ways. But I'm very excited to learn more about what's happening with this group. We have community health workers. We work with public health, both the county, and then I'm also part of, I co-chair the Community Advisory Board for UCSF Cancer Center. And we are also looking at navigation and CHWs from Bay Area wide. So I'm very excited to learn more about this and about the challenge. Thank you.
Thank you for being here. We appreciate that. I want to go to Lauren.
Thanks so much, Sarah. Hi, everyone. Good afternoon. I'm Lauren Ruiz, a Senior Program Manager with the Institute for Public Health Innovation. We have a rich history with community health workers here in our region in Virginia, Maryland, and Washington, D.C. And we really saw many of those programs flourish during the infused funding for CHWs from COVID-19. But now we have seen some of those programs drop off. And while some organizations have been successful in sustainability strategies, others have not. And we see the impact on community when these community health workers lose their roles and positions. So I'm really interested in the sustainability opportunities and the strengthened partnerships that can come from this work. So thanks so much, everyone, for joining today. I'm not sure, I think, Darrell, have you gone yet?
No, I have not, and I know IPHI well. Hey, everybody, my name is Darrell Fox. I've been a community health worker for over 30 years, since 1991. I work for JSI Research and Training in the Atlanta office, but I was born and raised in Boston. I got to say it that way. So I used to work in the Boston and Providence offices for JSI. I'm here because about 10 minutes ago, I saw this post on LinkedIn from one of our Notchwell board members. So I'm one of the founding members of the National Association of CHWs, as well as a couple of state and regional CHW networks. I work on many CHW projects, including a statewide youth gun violence prevention project for Massachusetts, and then something called the Washington State Evaluation Partnership, which is with Washington DOH. So I work with Jill Toombs and folks like that, Samira, and that's a national evaluation project for the CDC CCR programs, the CHWs for COVID-19 resilient communities, which is kind of winding down, and its fourth year for the evaluation players, evaluating over 67 grantees. But I'm here because I believe in, there's a principle on the second day of Kwanzaa called Kujichagulia. It stands for self-determination. And we talk about CHW self-determination, and I know you all have heard nothing about us without us. And so when I saw this 10 minutes ago, I said, I don't know this group. Somebody from Nashville posted it. I need to see what's happening and see how CHW is engaged. That's why I'm here. Thank you very much. I'm also eating, so I'm going to go back off camera. Thank you.
And thank you for taking time to join us. And we're glad even last minute arrivals are always welcome. And we're going to give you some more background and context. And so excited to have this conversation. Evelyn, I think you are left.
Good afternoon. My name is Evelyn Kelly. I'm a director with the Institute for Public Health Innovation, and I've been working sort of behind the scenes with Lauren and the Common Health Coalition as they advance this challenge effort, as well as providing some support, but also have some expertise working with community health workers, specifically promotores de salud.
Is there anyone that we missed? Well, we appreciate you all bearing with us to allow us some time to have introductions and for people to make connections and share their stories a little bit. We think that's really important in these conversations. This is the Common Health Coalition, while a year old, this challenge that has been issued only launched on December 9th. It's new and is in our infancy. It's important for us to take time to make connections and build community and talk to each other as well, even though we are in virtual spaces. And we know this is a really busy time of year always for folks. And so we really appreciate you taking time out of your schedules this week, when I know that a lot of people are cramming things in before they might try to be on vacation or something else over the next few weeks. And so thank you for your time. And I'm going to share my screen. And while I do that, I still want to invite you to raise your hand if you have questions, interrupt at any point, or put questions in the chat. We'll be monitoring that. We have about 15 to 20 minutes worth of content we want to share with you to provide some background. And then we're gonna and we'll have plenty of time for questions, but also don't feel like you have to wait to the end to ask questions. Let me just make sure I share my screen. Do you all see a pretty slide that has a big header on it? Started. Great. Okay, here we go. So what we're going to do, we're going to just make sure, so especially, Darrell, I love your story that you just heard about this and want to know what's going on. So first, we want to make sure everybody understands what is the Common Health Coalition. Then we want to make sure folks have a little bit of background on the challenge. And then we're going to talk specifically about this Catalyst Awards component of the challenge, and then how to go about being nominated for one, and how to go through that process of being a part of the challenge and the Catalyst Award component. And then lastly, make sure people know about the coalition membership at large and how to join that too. So we'll wrap up with that piece. We hope to go through this rather quickly, and so we can have time for conversations. And with that, I'm going to turn it over to Chelsea, the Managing Director for the Common Health Coalition, just to tell you a little bit more about the coalition.
Thank you so much, Sarah. And yeah, just want to echo the thanks for everyone being here during such a busy time of year. I really, really appreciate your time in entering this space. And for those who have been with us for the long haul, thank you for still being here. I'll give a really brief overview of the coalition. Also, as Sarah mentioned, we did launch this challenge just last Monday, and there is a recording of that on our website. And so we'll make sure to share that recording in the chat as well. If my team can hold me accountable to that, make sure I remember to do that so that everyone can watch it if they weren't able to make that launch. It was really a powerful launch, great stories shared, and exciting work to come. So the Common Health Coalition, who are we? What are we doing? This statement that you're seeing in front of you is really our mission statement to improve the U.S. health system so we're better prepared for the urgent health crisis of today and tomorrow. And really, how are we doing that? We're doing that by strengthening collaboration between healthcare and public health. I think those of us who are involved in the pandemic response in any way, shape, or form, or just experiencing it as a human being in the world at that time in the U.S., knows that amidst the death, destruction, loss of life, and livelihood, there also was immense innovation that came through. We saw barriers that fell away. We saw funding come in ways that we had never seen before. We saw data being shared between partners, tagging in folks who had been waiting to be tagged in and funded to do so. And so there are really these rich innovations that we want to make sure are not being lost just because that COVID response spotlight has faded. And we are here to elevate things that are happening on the ground in health and public health spaces that we want to ensure continue, not just from COVID response before, during, and after. We've all been working in these spaces a long time. If you have an innovative partnership happening in those spaces, we want to know about it. We're here to be your megaphone, here to be your connector, neutral, third-party convening space, and we're here to help. So that's really what the coalition has been here to do for the last year. We're continuing to grow. It was founded by the American Medical Association, American Hospital Association, the Alliance of Community Health Plans, AHIP, and Kaiser Permanente. But since March, the coalition has now grown to, I think we'll be hitting 100 members in the next couple of days. Many of your organizations are already members. And so really grateful to see that growth and just a shared sense of mission among those who are doing this work day in and day out. And we're here to elevate it and help replicate it across the country. Next slide. So this is, I won't spend a lot of time here, but this is kind of our four-pronged approach. You'll hear me say CARE, public health. We love an acronym, can't help ourselves, but it is helpful. So our focus is on coordination between healthcare and public health, always on emergency preparedness, real-time disease detection, and exchange of data really quickly and for equity. And we really try to focus all of our work around these core four focal areas. I'm sure that many of you are doing work around these core four focal areas, and that's what we're trying to capture, work that is happening across the country, not to reinvent the wheel, but mobilized for action. Next slide. So what is the challenge? So we launched this thing called the Common Health Challenge again last Monday, and we're really excited about this. It will be an annual challenge. So every year we'll announce a new topic that the coalition will do a call to action around to mobilize our members around one issue that really does cross between healthcare and public health, and for which the solution really relies on better partnership between healthcare and public health. I don't love the term breaking down silos, but that's what we're doing. We can't continue to exist in these silos. And that will bring me to the next slide of how we chose we're not here yet. Okay, this is the inaugural. I was going to say the reason why we chose the inaugural challenge to be community health workers was really because for hundreds of years, community health workers have been that link between not just healthcare and public health, but social services and other services that folks need. And so the inaugural challenges you can see here, this is just how to get involved. Taking the challenge, just like being a member of the coalition, is free. If you take the challenge and your organization is not already a member of the coalition, you are satisfying all of the requirements of joining the coalition. So we will consider you signed on as a member, unless you say you don't want to be a member, which we won't be offended. But essentially, this is an easy on-ramp to become a member of the coalition, is by joining the challenge. And then finally, an additional part of the challenge is why you're all here today, which is the Catalyst Awards, which is a monetary award, which we'll get into for the rest of this session. Next slide. Great. So taking the challenge and what that really means, essentially, you are committing to advancing partnership between healthcare and public health and working to improve community and resilience, health outcomes through the integration of community health workers. We are not here to reinvent the wheel. This is work that all of your organizations, many others out there, are already doing. We are here to help advance that true partnership link and codify it, strengthen it, and help others not just appreciate and understand the value of community health workers, but advance these partnerships themselves. So taking the challenge, these are 6 priority areas that we have identified thus far. This is really a floor, not a ceiling, of what we hope to see in terms of actions, folks raising their hands to take as part of the challenge. And we will, see many, many more beyond this, because I know all of your organizations are already doing this work. Next slide. Great. So now we are getting to the Catalyst Awards. So 10 organizations will receive $30,000 awards in Catalyst Awards in April 2025. That's when we will release the funding. The awards will go towards organizations that demonstrate an existing strong capacity to integrate CHWs in ways that strengthen that partnership between healthcare and public health communities, and those that demonstrate these 3 bullets below. So organizational readiness, proven track record, plan for strengthening partnerships between healthcare and public health. I don't mean to sound like a broken record, but this link between healthcare and public health really is our focal area here. And that is how we're saying this is different than perhaps other challenges or awards out there. We are here to really advance those partnerships, looking also for organizations who are already working, perhaps in a healthcare setting, but there isn't a formal connection to the local or state health department. And that would really help if they had a better exchange of data with the community health worker, receiving and being able to utilize that data if that partnership did exist. there's a litany of a range of options, but that's what we're looking to foster here. So I'm going to pass it back over to you, Sarah, but hopefully this is a helpful overview. I will drop helpful links in the chat, not just the recording, but also our FAQs and more information on the challenge. But again, just want to thank you all for being here, and we are so grateful for not just your time today, but your work and what you do every day.
Thanks, Chelsea. So we're going to talk more about the Catalyst Awards, but let me just pause for a second. Are there any general questions about the coalition or the challenge before we talk about the Catalyst Awards? Awesome. Well, while we go through the Catalyst Awards, and Chelsea just mentioned we have an FAQ document as well that talks about the challenge and the Catalyst Awards. We're updating it, and we have some additional Q&As that we'll be adding to it. But I also want to encourage that if you have any questions, make sure you put them in the chat because they could become part of our FAQ as we round that out. So don't hesitate to ask any questions that we may not be addressing. As Chelsea mentioned, this is a new effort. We launched a week and a half ago. I'm sure there are things that you all might think of that we maybe haven't addressed yet. And so we are happy to hear that feedback so we can make sure we can be responsive. So as Chelsea mentioned, we're looking for organizations that have this level of readiness or have the ability, as we're going to talk about how to become a Catalyst awardee, and Lauren will walk you through that step-by-step nuts and bolt process. But one of the things that we'll be asking for is to have your ideas on what is a plan for strengthening those partnerships. So inevitably being able to demonstrate that you've done some work before. It doesn't necessarily have to be with community health workers, but done work before where you build bridges or work your work is definitely focused on health equity issues, which everybody who introduced themselves, I think, talked about that already. So we know you already have that box, that mission fulfilled, and just making sure that you're communicating that in what you share with us. In terms of what to do, when we talk about this plan, this is where we're really wanting you to be thinking about the prize, the $30,000 that comes with the Catalyst Awards. Our intention is to see that be used to implement your plan. And the plan, the Healthcare and Public Health Partnership Plan that you will share with us once you get to an application process, we wanted to talk about that for a minute. So we have some suggestions for things that might be included in that plan. However, you all are on the ground doing this work and you may have ideas as well. So please know that our list of activity examples are purely that, examples. Innovative ideas are welcome. Ideas that we haven't articulated are welcomed. The bottom line is we want to make sure that whatever you're putting forward in your plan, that you know that it will advance, work towards making tangible progress in forming and sustaining a partnership that advances community health workers. That's what the mission is of the challenge. So we just want to make sure that's there. So here's some examples about making your partnerships more sustainable by having them be more formalized through memorandums of agreement or other such mechanisms, using the resources to do a community health needs assessment and then having it guide your implementation outreach, data sharing agreements, implementing education programs on the value and role of community health workers. There might be some tools and resources that you want to develop. Maybe some of you have mentioned that you're doing this work already, but you would like to see the community health and worker initiative that you have that has been proven to be successful replicated in 4 other communities, and you want to develop some tools so that you then can do some training and help expand that work in other communities. And also, as Chelsea mentioned, the Common Health Coalition has come out of the pandemic, and there's a heavy emphasis on really being responsive to the next emergency, being ready for it so we can respond more nimbly and more quickly. And so there may be some work that you want to highlight that's about mobilizing community health workers in response to health crises or being ready for that, and also making sure that the community health workers are able to be part of the process of gathering real-time and early detection data, just as an example. Again, these are just examples of activities. You should not be limited by these examples, but we wanted to give you a sense of the types of activities that we think the resources could be used for. So what can a Catalyst awardee expect from the coalition? One, you can expect to receive a prize of $30,000 that would be used in a 12-month period of time. There also will be a community of practice, which I'll talk about in just a minute. And then you also will receive technical assistance to support your implementation of your partnership plan. You might be asking, what does that technical assistance looks like? it could take many different forms, but one of the things that we will be doing as we go through this process of collecting information through a nomination and application process is learning more about what you are already doing. And it also will help us identify gaps so that we can target the technical assistance to best support your organization where it is at the time that it starts this award. And we'll be doing that technical assistance and working with some of the several of the partners that introduced themselves today in this call. What do we expect of Catalyst awardees? We expect that folks will implement the plan that they have submitted in their application process that they plan to implement, that they will participate in the community of practice, and that they also will be willing to contribute to the development of resources on sustaining community health worker programs that are integrated. And that may be that the Common Health Coalition is developing case studies or success stories or recognition program, that you have made staff available for interviews, vetted quotes, reviewed potentially some materials that we have written that will help tell those stories, and that we are able to engage you at different times, not overwhelmingly, but we want to make sure that we have got the input from the experts in the field like yourselves to be part of the development of these tools and resources. So the community of practice, all of the organizations that are nominated for a Catalyst Award will be invited to join the community of practice. The community of practice will be a private virtual learning exchange platform. Probably many of you are familiar with such a platform, something that's behind a firewall where people can talk and exchange of tools and resources, be able to have some conversations online. We will host webinars quarterly that will focus on the peer-to-peer learning exchange, and we will be highlighting different themes, each of those quarterly calls related to community health worker program initiative and implementation. There will be opportunities to share your knowledge, ask questions, get expertise from other people we don't want to reinvent the wheel. We want people to make sure we're sharing information and stories so that people can learn from each other and elevate the work together. And then it will also provide an opportunity for problem solving, having discussions about one challenge. If you're having a challenge in this region of the country, probably somebody else is as well. And so we want to make sure that you have the opportunity to facilitate those conversations and be able to unpack that and figure out how to solve that problem or mitigate those barriers, and then put into practice what you learn. To help inform this whole effort, we are currently conducting a survey, and it is online. There's a QR code here for you to access it, and I'm sure someone will drop in the chat in a second the actual direct link to where you can do the survey. But we really encourage you to do the survey and also to share information about the survey with your network, because the survey is about what is happening in your organization or others about community health worker initiatives, and it will inform the programming that we deliver in 2025, and it will inform the technical assistance provided to the awardees, and it will inform the programming that is part of the community of practice and how we support and share information. We need a better understanding of the scope and scale of your organization's work, and want to make sure that we are providing the support that is most needed. As Darrell mentioned in his introduction, that it's so important to engage community health worker leaders in this work. We want to make sure we're hearing from you and that this work is consistent with what you have identified as necessary and important, and consistent with where you know there'd be best practices as well. So I'm going to turn over to Lauren, who's going to talk about the nuts and bolts, but this is just a quick snapshot so you can see at a high level that we are doing this process over a couple months. I've hinted at nominations and applications that might be a little confusing, and Lauren's going to break it down exactly what the step-by-step process is. Our goal is to make this low barrier to entry, and we're trying to make this a low burden process for all of you. So hopefully this will make it clear what Lauren shares, and then we of course are happy to get more questions and hear from you all, and any feedback is welcome. So with that, I'll turn over to Lauren.
Thank you so much, Sarah. So yes, everyone, you can see our timeline for the Catalyst Awards here on the screen. We are now accepting nominations, and we'll now talk about how you can nominate. Next slide, please. So as we've been talking about organizations really poised to implement or advance impactful CHW initiatives that strengthen partnerships between public health and healthcare, you've probably already started thinking about an organization, either one that you know of or work with, or maybe even your own organization. So the good news is you can nominate both of those. You can nominate an organization that you know or work with, or you can self-nominate your own organization through the nomination form that's been shared in the chat and is available on the website. You can nominate more than one organization, and you can also nominate an organization and self-nominate your organization, as long as the nomination eligibility criteria are met. So let's talk about that now. An organization is eligible for nomination if it has experience implementing initiatives related to community health, public health, or related healthcare collaboration and sustainability efforts. If it's located in the United States or a U.S. territory, and if it meets one of the organization type eligibility criteria. You can see the list of eligible organizations on your screen here. There's also more detail about these organization types in the FAQ that's been shared and is available on the website. But in short, nominations will not be accepted for individuals, federal government agencies, or organizations outside of the U.S. or one of its territories. Next slide, please. Another QR code that you can access for the nomination form, and that link has already been shared in the chat. The form asks for basic information about the nominator and the organization being nominated. We're thinking things like name and contact details, the name of the organization, and then a few additional details about that nominated organization, like the state that they're in, the organization type, and the size of their reach, which those last two are in drop-down menus to make that a really easy selection process. There are also two open-ended questions on the nomination form, and you can see them on the screen here. These questions speak to the nominated organization's readiness, past performance, the population that they serve, and their potential impact. 500 words is about a page, but you don't have to write that much unless you really feel like you need to. Include what you know about the organization and really just expand on your reasons for nominating them and how that aligns with the challenge. When describing the population and demographics of the community served, information helpful to include are things like, does the community served include urban, rural, or frontier areas? Do they have high or limited access to healthcare coverage? Is there any diversity in socioeconomic status, race, gender, or other social determinants of health impacting the population? All of these details, again, are included in the FAQ and in the nomination form. So let's move on next to a couple of examples of eligible nominations. Through our introductions and through the introduction to the challenge itself, we've heard generally about some programs that might fit the bill for what the coalition is really seeking. We're going to dive very quickly into three more examples. The first is a community-based organization serving a single entity. In this example, we have a community-based organization who's in partnership with an independent school district to integrate community health workers into a school-based mental health team addressing urban trauma. The school district nominates the community-based organization for a Catalyst Award because they're looking to establish a relationship with local emergency rooms to inform early detection and response to community health issues like overdose deaths happening in these communities. In our second example, we have a health system serving one or more town, county, or city. In this example, a health system serving several rural counties self-nominates to enhance their relationship with the Public Housing Authority. They've implemented a community health worker program with the PHA to conduct social determinant of health risk assessments, connect residents to services, and provide health management education, including information about things like vaccines. With Catalyst Award funding, they seek to develop tools and resources to share successes and challenges and support expansion of community health worker initiatives. And finally, in our third example, we have a public health institute serving a statewide population. Here, a local health department nominates a public health institute for a Catalyst Award to facilitate the development of formal memorandums of agreements between organizations implementing community health worker integration into care teams at maternal and child health hubs that have been established to address maternity care deserts and increase access to maternal health resources. So you can really see the diversity of eligible nominees here. And again, you're probably thinking of your own organization or one that you know that is really starting to look like they meet the criteria for nomination. Next slide. So what can they really expect once they're nominated? A group of reviewers will assess each nomination. These reviewers have experience in community health, public health collaboration, and have implemented successful community health worker initiatives. They'll read each nomination and consider things like past performance, population served, commitment to equity, potential impact, etc. Really, they'll make an overall recommendation to invite to apply or not invite to apply. We'll aggregate those, and then to ensure a diversity of applicants, we may consider things like geographic location, organization type, or organization size in those final decisions. Next slide. In addition to the frequently asked questions that have been shared via chat, there might be some questions that you're thinking about already. The first one, if I'm nominating an organization, should I tell them beforehand? We recommend that you do, only because they're going to find out about the nomination anyway, and letting them know can be helpful in identifying the best point of contact for the organization and giving them the most time to think about their application approach. Another question, what happens after I submit the nomination form? You'll receive a confirmation that the nomination has been submitted. We'll also share information about the nomination with the nominated organization. They'll have the opportunity to correct any misstated information included in the nomination form, but not to provide additional information unless they're invited to apply. As a quick reminder, we are currently accepting nominations, and those will be accepted through January 24th. So now we're going to get into that next detail about how does a nominee actually receive a Catalyst Award. Next slide. You can see we're moving through that timeline. So once we receive all of the nominations by January 24th, we'll go through that nomination review process. And by February 21st, we'll invite organizations to apply. Next slide. The total number of organizations invited to apply may vary depending on the volume of nominations received. But those organizations will all receive their notification by that February 21st date. Next slide. Organizations invited to apply will receive more information with their application invitation. But in short, you can see a sample of the application form here. In addition to organizational information and some more detailed things like organizational EIN and annual operating budget that someone really internally from the nominated organization may best know, we're going to ask them to expand on some of those open-ended responses and provide a budget narrative. Next slide, please. We'll include all the information an applicant needs to apply for a Catalyst Award. Information about the coalition and the challenge, detailed instructions on how to apply, and links and other resources relevant to the application. As Sarah mentioned, we'll also be available for technical assistance, not only to awardees after award, but also during the application process. If you have any questions specific to the application process, the Catalyst Awards, or the application form, just reach out to the coalition and we'll be sure to walk you through that. Next slide. That application deadline for those invited is March 14th. So you can kind of start thinking about how this may play out as your organization goes into the new year and you start planning your next initiatives. Next slide. The review process for applications will be fairly similar to the review process for nominations. Instead of a yes/no recommendation, however, reviewers will complete a scoring rubric for the applications received. This will help us to aggregate, rank, and really consider some of the specifics of the applications that we receive. Again, to ensure a diversity of Catalyst awardees, we may consider additional factors like geographic location, organization type, or organization size. Next slide. And following that review, organizations selected to receive a Catalyst Award will be notified by April 11th. The individuals identified in the application will receive that announcement of selection and will work in collaboration with awardees to publish a press release announcing that award. We'll also host an orientation for awardees, which will be held in mid-April. And now we'll open the floor to any questions that the group may have.
Hi, this is Lisa Taylor. I'm sorry.
Go ahead, Lisa.
I just had a question about reporting your progress. Is that like a monthly, quarterly? What's the time frame on the reporting of your activities and progress?
Yeah, that's a great question, Lisa. More details will be included in the information sent to the organizations invited to apply. But generally, we do want to keep this low key as the award is $30,000. So we'll really gather some of that information through the community of practice. And then we may also engage, as Sarah mentioned, to gather success stories or to glean information about your progress and successes in other ways, but really low impact, no written reports required monthly or anything of that nature.
Great. Thank you so much.
Yes, ma'am.
Samira?
Thank you. So the Department of Health has community health worker work kind of happening in different places within the agency because we're so large. So I was wondering if, are we encouraged to submit one application representing the Department of Health, or would it be all right for multiple ideas coming from one place, from one organization?
We really encourage the one application per organization. We feel like you all know best what the need is. And so we really hope that that infusion of funds, if selected for an award, would be put toward that program that needs it most. So we'll let you all make that decision. And we hope to be able to support your other initiatives in other ways through resources, community of practices, and other things. But please, for each organization, one application.
Got it. Thank you.
And just as a reminder, we really are trying to make the nomination process very low barrier. Part of why we are doing that was so that we could get a better sense of the organizations that folks know about that should be considered for this, and also allow for self-nominations that you would like your organization to be considered, but really letting the kind of raising your hand, I'm interested, here's a little bit of information about ourselves. As Lauren mentioned, why that nomination form says up to 500 words. It is not necessary to write more than a half a page. We simply just want to give you a chance to tell us a little bit about your story or the organization's story in response to the questions that we identified, but we wanted to be flexible too. The real more in-depth work will happen with the application process. But really, please consider this a low barrier to entry to let us know you're interested in finding out, having an organization be a recipient of the Catalyst Awards. And we also really want the community of practice to be open to all nominated organizations. And we want that to be a thriving, robust group community of folks that are engaged in this work and looking forward to engaging with each other. And so we really want to make sure that's a big tent that's embracing others, organizations. Any other questions? I just want to uplift that we saw Tracy's question about getting more information about the survey available, which makes great sense about knowing what questions are coming. And so we're updating the survey link so that it'll have a link to the PDF on it so that you can download and look at. And I also just want to mention too that Lauren mentioned we have these FAQs. There's a couple FAQs that will be updated. So just you can check back later if you have some questions or something that wasn't answered. Remember the email address is info@commonhealthcoalition.org that you can email with any questions. I know someone will type that in the chat in a second. And that way we can keep providing additional responses to questions. Just keep in mind that this is a new initiative and we're learning as we go through it. The first inaugural challenge for community health workers will really set the stage for future challenges. And so your involvement and partnership through this process is really useful for all of us as we learn and get better and set ourselves up for success for future critical public health issues that the Common Health Coalition wants to tackle. Let me just pause there. We have a few more minutes. Are there any other questions about this? I know a few folks weren't able to join in the very beginning. I'll just mention that we recorded this webinar. We will make sure that the PDF of the slides is also available for folks. Everybody who registered will receive an email with a PDF link to the slides and a link to the recording. Additionally, the recording will be put on the Common Health Coalition Challenge website, where you also can find more information. I know for folks that joined later, not always does the chat show up for you. So we'll just make sure to drop in the link to the challenge website. And from there, on that challenge website, you can access the survey that we asked you to complete. You can access the nomination form for the Catalyst Awards as well. And those are two of the big important things that we want to make sure people can access. Are there other questions?
And I'll just chime in just for those who are not monitoring the chat, perhaps from phone. Tracy, thank you for your question about the survey questions ahead of time. I know it's always nice to see what you're answering before you enter into a survey. That is now updated on the survey. So there's a PDF that you can download of the questions ahead of time before you complete. So thank you for flagging that. And I just went in and fixed that now. So thanks.
It's a great case study of showing how responsive we can be to the questions we get from folks in this community so that we can better support you and help you be engaged. So please don't be shy about sending in questions. Don't hesitate to ask us a question. We may not have addressed it and we want to be responsive. So please make sure to let us know. Okay, I'm going to pause and see if there's anything else anybody else wants to bring up.
I do have a question if I can jump in really quickly. Considering the linkage between healthcare and public health is the emphasis for that. I know that there are opportunities, of course, to strengthen, and we hope to continue strengthening our public health work. I'm just curious with the time phase nature of the award itself, if there are any implications of not being able to kind of fulfill the proposed activities within the time frame, kind of what that looks like, or extensions and things like that might be eligible as part of this. Just trying to think forward in terms of some of the challenges we've experienced in the past with needing to pivot where we need to because of other things happening in the public health level. So just kind of what your thinking is on that term right now.
I can field that one for now, but anyone, please feel free to jump in from the team. That's a great question, Tracy. Again, we know the size of the awards, so we really want to be realistic in the scope that we're thinking about in the partner utilization plan, really using those funds to strengthen those partnerships between the institutions. So if you have planned implementation activities, those may not necessarily be something that we're as concerned about seeing completed within the time frame, and we can kind of be flexible with how you're progressing with that in the progress. But again, really it's focused on the strengthening of the partnerships. So as long as there's progress being made on those, maybe if there's some implementation things that haven't happened yet, we can be flexible, and that wouldn't be as much of our focus. But Chelsea, others, do you want to chime in on that?
I wanted to mention one thing too, is that I think one of the things that we're also considering, and I think you'll find out more on that nomination and application form, is that we'll be thinking about making sure we have diversity of organization type, size, and region and population reached for these Catalyst awardees. So also that progress that has to be made is not the same for every organization by any means. We want to learn in this process as well and be able to develop tools and resources for other organizations. And there's so much diversity in organizations that are working with community health worker initiatives in terms of the size, their scope, their mission, how they're reaching folks. So I think we are flexible about what that plan is going to say, because we want to make sure that there is a whole wide variety of activities that are being addressed so that we can be learning more about this implementation and these efforts to develop these partnerships in a wide variety of different settings, communities, et cetera, too.
Oh, we really appreciate that because I know I've applied for different types of funding, and when you're in competition with very large organizations, it kind of skews the process because, of course, like in our case, we can't compete with, like a food bank or, some of those other organizations. So I appreciate that you'll be taking in consideration a diversity of organizations in terms of size and scope.
That's right. We definitely don't, I mean, we are seeking to have 10 awardees that are diverse in nature in a host of categories, right? We're not necessarily just looking for the largest organization with the biggest reach with the biggest funding. So I'm glad that you asked. It's great. Okay, we have about 30 seconds left. Any other questions people want to elevate? And also just noting, if you're not receiving emails directly from the Common Health Coalition, feel free to drop your email address in the chat to make sure that you're getting those. We want to make sure people are looped in and connected to the coalition. So today we shared information with you about the challenge, the Catalyst Awards, and also I know Chelsea mentioned this at the beginning, that if you're choosing to be part of the challenge, you're opting in to being a coalition member, but you can find more information out about the coalition in general at the website. And we want to make sure that you're connected to the network and we get to communicate with you and hear from you as well. So please make sure that you've let us know who you are if you're not receiving that direct communication, so we can make sure to keep engaging you. And with that, I just want to thank everyone for joining us this afternoon and giving us your time. You'll see more information coming out. And please, a reminder, don't hesitate to let us know of any questions that you have. We really appreciate everyone's time today. And thank you to everyone for being here. We hope you have a healthy and happy new year.
Thank you. Same to
Thank you.